Hello, everybody, and welcome back to the second half of the Expo of Batch 4. Now we continue with Sanofi. First of all, my warmest regards to all of our Sanofi colleagues and teams in Frankfurt, Paris, Singapore. We would love to host you soon here in person again and hope that we have a chance to see each other soon. Thank you very much for the collaboration. It has also been a great and successful batch with you and with the pilot owners and the startups from your side. And we are really excited that we have you as a global partner with us in so many different locations to jointly transform healthcare together globally and also within the country. With that being said, I would like to introduce you to Harshavardhan GK, who's the global category head for pain care at Sanofi Consumer Healthcare. Harshavardhan, welcome and nice to meet you virtually. Thank you for joining us today. It's an honor for us to have you here, and also it's an honor for us that you give the introduction and opening remarks for Sanofi.
Thank you very much. Good afternoon, everyone. For those of you who are on the other side of the world, good morning and good evening for the other side again. I'm really happy to be here today with the Sanofi team to close our fourth batch of challenges with Startup Creasphere. In this round, we have 3 challenges focused on headache, chronic pain, and stress. Our internal teams have already started working very hard over the last 4 months on their projects. I know that we will see some great pitches today. By partnering with Startup Creasphere and Plug and Play, Sanofi Consumer Healthcare is showing our commitment to working closely with startups to accelerate our digital offerings to our consumers. For those of you who don't know much about the Sanofi Consumer Healthcare business, we are part of Sanofi, a global healthcare company which is based out of France. And we are one of the top 3 consumer healthcare companies globally. We're committed to providing people all over the world with consumer-centric, innovative self-care solutions to manage their personal health. And we focus on healthcare in 4 categories: pain care, which I'm a part of, digestive health, nutritional health, and allergy, cough, and cold. And we know that if we want to win with our consumers, we need to deliver products and services that meet their needs, which means evolving our businesses towards incorporating digital solutions with our traditional over-the-counter products. As part of the global team and working closely with our local countries, my team and I interact on a regular basis with consumers, including now during this lockdown, where we meet consumers via Zoom. And increasingly, we are hearing more and more about how consumers want a seamless, simple, digitally enabled solution to improve their health. So while talking about this, I thought it's a good opportunity to walk you through a real example of how these consumer unmet needs have led us to a solution which we're recently learning. We learned from people who are suffering from irritable bowel syndrome, commonly known as IBS, that these sufferers have actually regular episodes of abdominal pain, sometimes coupled with diarrhea, sometimes with bloating, sometimes with constipation, or a mix of any of these. And the worst part is it's completely unpredictable, and that impacts the person's life in a significant way. Did you know that the first thing an IBS sufferer, when they try to go and meet someone or go to a new place, what's the first thing they look for? Our consumers told us that the first thing they look for is the nearest toilet. Such is the negative impact of IBS in their lives. And to top it all, 96% of IBS sufferers actually do not know that they struggle with IBS, and they live their everyday lives in frustration. Here is a huge unmet need where consumers are not able to solve it because they don't know what they struggle with, and they need a clear solution for them to improve the quality of their lives. And so we decided to provide an end-to-end solution to this particular consumer. While we are good at strong OTC solutions, and we already have one for this in the form of a product called Buscomint, which is a peppermint oil-based product that works really well, we discovered that the product alone was not sufficient to manage IBS for our consumers. So our consumer deep dives actually showed that there were very strong connections between stress, food, medication, etc. on their IBS episodes. And the consumer needed more than just a product. So we tied up with an online solution, which is Karacare, which allows us to learn and enable the consumer to track their mood, food, poop, etc., and thereby enabling them to understand their IBS condition a little bit more deeply, and more importantly, offer them a very clear beyond the pill solution to manage their episodes in such a way that they have a better quality of life. And more importantly, this is a beyond the pill solution as well. So like this, most OTC healthcare has unmet consumer needs that cannot be solved by just a product. So we need to assemble a meaningful consumer journey and a consumer-centric ecosystem for healthcare. And in this case, Plug and Play is a great platform where we leverage to bring these beyond the pill parts and solutions together along with the product part. So my mission for digital health for Sanofi Pain Care is to provide, along with our teams, to consumers an end-to-end ecosystem to stay connected, to self-diagnose, measure, treat, anticipate, manage, share, and buy, all while navigating through a simple and an effective journey, thereby leading towards an accessible self-care in their hands. I'm really impressed by this innovative and agile mindset behaviors which our teams are bringing in back into the Sanofi by the sheer interactions which they're having with startups like you. And we really value this partnership that we've started with Plug and Play. Our teams are really looking forward to today's pitches and taking the time over the coming days to learn more and more from each of this batch of startups. So thank you very much for the opportunity to engage and interact. And more importantly, I wish all the pitching teams the very best in learning and growing together. Thank you very much.
Thank you very much, Harsh, for the kind words and for sharing also the real example of IBS, as well as sharing the mission that Sanofi Consumer Healthcare has beyond the pill. And it's great for us at Plug and Play to see, and also on how you work with the startups globally, with the teams in different countries. And we're extremely proud to have you as our partner on our platform globally. Thank you very much, Harsh. So with that being said, my warmest regards to the team at Sanofi and good luck for the pitches. I'm handing over the word to my colleague Fabian for the Q&A for the startups. And also please bear in mind, and thank you again, the startups are dialing in globally from very different time zones. So thank you for spending this time with us, no matter what time of the day. We highly appreciate it. We have over 320 participants currently. So thank you all for the different teams, especially now in the Asian area where it's already late at night. So thank you very much. Warmest regards, and handing over to Fabian.
Thank you very much, Friederike. We are at Plug and Play are extremely excited to have Sanofi as a global partner and to also work with them together in multiple locations. For the Sanofi portion, we will see 3 startups today, based out of 2 continents. And then I would say let's directly jump into the first startup pitch. They've actually been part of our Startup Creasphere program in Singapore, so soon to be Startup Creasphere program in Singapore, our Singapore portion. So Wellteq, and then Scott, please feel free. We will see the video and then directly jump into your pitch. Looking forward to that.
What's special about us? It works. We achieve behaviour change for health improvement, and that's demonstrable through some quantitative outcomes.
When I first saw Wellteq pitch during the demo day in Singapore last year, I was really excited to see that the solution fits to the challenge that Sanofi is proposing like a glove. Well, we are working with Wellteq to build a personalized app to manage stress through improving overall health and wellness. That you need to be very certain about the challenge. We created the challenge based on an idea that came out from an innovation workshop for the international region, Gain Support. It's really important to validate your idea and also gain support internally from your key stakeholders.
Fabian, and good morning, good evening, everybody. My name is Scott Montgomery. I'm the founding CEO of Wellteq, based here in Singapore on a nice balmy evening, as they are. I'm going to talk to you today about the project that we are tackling head on. And to do that, I've got a very brief visual here for you to take you through. So the mantra for Wellteq, and this is where we connected very, very deeply with Sanofi almost immediately, was we're to empower healthier, happier people. And when Sanofi mentioned that one of their core objectives is to go beyond the pill, that resonated deeply with us. So we are a personalized digital health solution. Now, in this point in time at the moment where COVID has strangled the planet, what's been really interesting is the effect that it has on every single person. And those symptoms are almost a lot of the time the solution. And just a couple of points here that as we go into social distancing and isolation and lockdown, we are less active. Our nutrition choices are poorer. We're more likely for situational snacking. Fatigue through Netflix binges or house partying late at night starts to lead into a less resilient mind. And then you're adding more stress into it with often employment uncertainty, potential financial certainty, and that can manifest itself into a state of mental distress. Now, when you're talking to someone in a state of overwhelm, it's very difficult to prioritize going to the gym, eating clean, being healthy, saying no, because we've got other more important aspects or urgent aspects of living that we need to address. So what Wellteq does, we are a smartphone application for a user, half of the business, where we integrate gamification, telehealth, digital pathology, behavior change programs, and wellness content into a user experience for daily and habitual behavior change. The data analytics side of the business, obviously there's an enormous amount of information or digital footprints created for each user. And at a population level, we're able to analyze these and find clusters of risk and performance that we can then in turn personalize our solution back to those particular clusters. So we work the full end of the spectrum from well-being, wellness, performance into risk identification and mitigation by prevention strategies. And then when people need care, we introduce very specific solutions, telepsychology, telemedicine, and allied health consultations from a distance, which is all the more important now that we have these COVID restrictions. We have care plan capabilities in certain markets for condition management. We work with large employers around the world. To date, we've operated in over 30 countries. We're about to launch our 10th language. And those employers and insurance companies that we've worked both in retail and enterprise span a raft of different industries. Now, interestingly here, these habits that we're starting to coach and starting to train give us the outcomes of health improvement, specifically stress reduction, resilience, and fatigue improvement. Now, we can get into deep granularity of data. Very specifically, on the left-hand side of your screen, you'll see two operating companies, one with a shift change pattern and one with a 9 to 6 desk workforce. Now, very, very clearly, that operating rhythm of the shift change has the triple peaks of spiking stress at the time of shift change. Now, that's tempting comorbidity event. It's also putting people under more stress for even things like workplace conflict, data entry errors, or slip, trip, and fall injuries. So from just a stress metric, we're able to quantify on a continuous capability. We're able to understand how people might be at risk. The Sanofi project is a stress buster project. We are helping people identify stress in their lives and then personalize the way that we can help mitigate that stress for them. I've got a very short overview of what that project looks like.
The Stress Busters app starts you off answering a short 10-question health risk assessment, generating a personalized health report based on your lifestyle, physical, clinical, and mental health scores. You're then presented with a personalized health goal recommendation list to select from. By connecting a wearable or activity tracking app, your dashboard is updated with daily habits, stress, and resilience scores. AI technology then feeds our coach and nudging system to tailor the content that you see in your social feed, further educating you and building a stronger foundation of healthy behaviors. Everything can be connected socially. Community is a really important hub for both group and for individual challenges. Gamification has been built into informational content, leaderboards, and for the consumer, a reward system. There are a variety of other features you can access through the More menu, including your profile with message boards, the ability to heckle and high-five others, earning badges, and accumulating points along the way. This is digital innovation, going beyond the pill to help our consumers live longer, more stress-free lives.
The lovely thing about this is that this is not a spray and pray content distribution. We're actually engaging people and then empowering them towards a change. And that's the exciting part, because we can have a large impact on many illnesses and conditions around the world. With global reach, we're able to affect multiple languages, multiple cultures around the world with a very similar engagement strategy. Thank you very much for your attention. Sanofi, you're a great partner. Plug and Play, a fantastic platform. So again, I hope you enjoy the rest of the afternoon or evening.
Thank you, Scott, for that presentation. Really good to have all those insights. So we already have the first bunch of questions here on our side. First of all, how did your solution translate into tangible outcomes, such as increased productivity, employee loyalty, or less sick leave?
So we have a multitude of data points that we capture per user. Some of those can be through retrospective data analysis from medical claims, can be HR records from organisations around retention and attrition. Net Promoter Score is a powerful monitoring tool for us from a user standpoint. And then we've got biomonitoring that we do through, we can conduct through wearable trackers, heart rate variability, resting heart rate, sleep quality, sleep staging, and then some digital pathology functionality as well for more episodic testing.
Okay, incredible. How does your solution compare to, especially in the diabetes space, for instance, compared to Sidekick Health, which also has a biomarker tracking approach, and thereby also the gamification approach?
Certainly gamification is a widely used tool. We are not targeting diabetes management as at today. The solutions that we've got are more upstream to diagnose condition en masse, and that's where, in particular, the at-risk and the risk identification is key, and helping people empower towards daily habits as opposed to disease management.
Okay, fantastic. Maybe adding up to that, what's the plan for the future? What do you want? How do you want to extend your portfolio of services you provide?
Well, two ways. One is geography. We're a volume play. We're for everybody to help improve the way that they feel and the way that they live. And certainly is extending that continuity of care into specific condition management and connected patients through vital monitoring and outpatient functionality. So it's a very exciting extension of functionality for us over the next 18 months.
Okay, fantastic. Scott, thank you so much for clarifying all those questions. As always, also thank you for that, for participation at such a late hour for you. I'm really glad to have you. And if you're sticking around, you can also mingle later. And all of you who are interested to talk to Scott, please go to Remo.
Thank you, Fabian. Thank you, everybody. Enjoy your evening.
Okay, then up next, we have Music Care, our dear friends. They are based out of Paris, and it has been such a blast to work with them together. So Stefan, after we see a video, please kick it off and give us an introduction to your lovely startup.
So we had a clear brief from the beginning. The brief was to find a music intervention solution. We scouted more than 20 solutions, and Music Care was the only one with clinical study proving efficacy, already present in more than 300 care centers in France.
Currently, we are testing with Sanofi our innovative approach to pain management with patients and doctors. The next step will be to test our strategy development and business model. It is a huge privilege today to work with an amazing team of experts who are dedicated to the success of our project. The knowledge we gained will be utilized for many years to come. Thank you.
And we got the work done in the time frame we had, with positive mindset of the whole team and positive feedback as well. So all in all, it worked great.
Hi, Fabian. Hi, everyone. So I'm Stéphane Guettin, the founder of Music Care, and I would like to thank before to start Fabian, Christina, Felix, and all the team of Plug and Play, and also Sanofi, and to give us this amazing opportunity today to present our work. And with Music Care, we've been working for more than 20 years on effect of music on pain. And I'm pleased to introduce you Steven, who will present you our Music Care solution today.
Hi, everybody. So I am the Chief Marketing Officer of Music Care. Give me 1 minute, let me share my screen. So as Stéphane was saying, Music Care is a clinically proven solution to relieve pain through music. As we all know, over the past years, the use of medication to treat pain, such as opioids, has been exponential. This use is a leading public issue. We also know that patients are looking for other solutions that are beyond the pill, and this is where the collaboration started. So Music Care is a music-based method that has been medically proven to reduce pain by up to 52% with no side effects. I'm going to play a small 30-second video where you can see Music Care in action in an actual hospital.
Since June 2016, the American Hospital of Paris uses the Music Care method during the treatment of pain and anxiety. Music Care is a digital application in music therapy, making it possible for the medical teams to organize personal sessions for patients in hospitals, who then will be able to continue this care at home thanks to the application. The effectiveness of these sessions has been proven by the scientific research in the treatment of pain, anxiety, depression, sleep disorder, and in the reduction of medicine consumption.
So as you know, pain is an unpleasant sensory and emotional experience. So this is where music comes in on the emotional side. Sensory action is a pharmaceutical solution usually. So analgesic drugs act in various ways in peripherals and central nervous systems. And on the other side, we have emotional action, which is a non-pharmaceutical solution, such as Music Care, which stimulates neurotransmitters such as dopamines, endorphins, and oxytocins. As Stéphane was saying, Music Care is the leader in the science and research of music. For over 20 years, we have partners all over the world, from McGill University in Canada to the Ohio State University to La Sorbonne, and of course, the University of Paris. And again, this has been going on from 1999. Stéphane has been devoted his life to Music Care and the research of music, and there's over 150 peer-reviewed journals. So the Music Care science, the meat behind what Music Care does, is actually the music itself. And the way the music is composed is in a form of a U. As you can see on this graph, the variation of the music has a particular drop, and the music itself is built in that way. So it drops, and then it comes to the bottom of a U, and eventually it comes back up. And when it comes back up, it does not come at the same level as it started, leaving the patient in an absolute state of relaxation, and in some cases, coming out of sedation. So the sensory cognitive effect, we've been proven this in many studies. It's very important to mention the connection between neurofeedback and the hypnoanalgesia to fight the pain and anxiety. So the original music itself, we're very proud that we compose the music with very renowned artists that have worked with some of the legends that we know of, such as Bob Marley, the Wailers. We have Tony Allen, which is part of Blue Note and the jazz label, David Bismuth, a great pianist, Marc Bitrumur, Renan Fetchacordis, and there's actually many, many more. We can only fit 4 on this screen. And with these amazing composers, we've been able to create a nice synergy between music and science, and music and medicine. And what we've essentially done is taking their art and connect it to vital parameters that allow you to play on the person's well-being. The application itself is a digital e-health app, as similar to most apps that you've probably used to play music, with the component of this medical side to it, where it'll bring you within a treatment. This app is AppCare certified and can be downloaded on any Android, iOS. It's very data-centric, so we analyze the pain levels before you start your session and as well as after. As you can see, we have a 0 to 10. We ask that before and after, and actually patients and doctors and professionals get this data to really see how the pain level of their patient is dropping over time. So music care can reduce, as I mentioned in the beginning, can reduce pain by up to 52%. Here's a study that shows it. So it's basically a study that was taken for 2 sessions per day for 2 months, and it reduced that pain by that rate. And we can see the consumption of antidepressants and other pharmaceuticals would drop or would kind of level off with the use of music care on the side of it. This is another study that talks about the relaxation, the effect. Again, these are all available on our website as well. You see the bisexual index and how the control group and music care group has such a difference. So music care has been validated by many, many institutions and many large groups around the world. We're very proud to work with groups like Baylor, Scott and White, Providence University, United States. There is a long list of universities that are more European, of hospitals and universities. We've also won a few awards, Silver Echo, Trophy of Tomorrow, Demain, sorry for the translation, and Victoire de la Médecine in 2010. So we want again to thank very much Sanofi for what they've done and how they've helped us, and they've really done an intense study over 3 months covering all angles of music care talk to doctors, talk to patients, talk about what's working, what doesn't, how can we improve, how can we be optimal. This has been an unbelievably valuable information for the company for the future of music care. And this is again the collaboration Sanofi and Plug and Play. So again, the collaboration was always the objective of how do we together fight pain with 2 solutions that we know work. So the pharmaceutical and the emotional action of it. This is where the pill versus beyond the pill, the pharmaceutical and the non-pharmacological. And we want to finish on one great saying by the great Bob Marley: one good thing about music, when it hits you, you feel no pain.
Thank you very much for that great presentation. Well, I assume after the 3 months, you know your company even better now.
Absolutely.
So we have the first couple of questions incoming. The first is, are you primarily acting as an extension or beyond the pill approach, or could you actually substitute pharmaceuticals?
I'll answer that one. So the objective is not necessarily to substitute, is to work with pharmaceuticals. You can, in theory, just use music care, but the objective here is how do you get the optimal rates of pain reduction? And we still know that, again, pharmaceuticals does have an effect. We want to mitigate the quantity of pharmaceuticals and, more importantly, the addiction to it. I think that is where the whole beyond the pill concept comes into play, is how do you take somebody off the need of, like, if I want to reduce my pain, I need to take a pill. No, you can listen to music care, and when it really gets intense, you can take a pill to maximize that effort.
That's a great vision. On another note, how do you select your music interpreters? Do you choose specific artists for certain diseases, or is it more the generalistic approach?
Could you repeat the question, please? That it was a bit low.
How do you choose your artists? Is it you choose your artists for specific diseases, for specific pain, or do you select in a generalistic approach?
So it's more a question of demand and to have a varied selection of music. That's a very good question, but there is no connection between the artists that we choose and the actual diseases or treatment themselves.
Okay, so also the genre wouldn't make such a huge difference. for you?
No, the song itself, all the music is composed the exact same way with that U sequence method, whether it's jazz, whether it's reggae, whether it's world music or even rock. I mean, it's unbelievable how the genres are very, very different, but you're going to see the same effect no matter what song you listen to or by whom. Okay, very interesting. One more question in that specific regard is, how do you look to further innovate your solution? So the idea, the objective of MusicAir is to grow, more importantly, the catalog, to work with more and more artists. Because we know that the more catalog of music there is, the more just a standard user will want to grow. We're also working on solutions with immersive imagery, with some very big artists. But our primary focus has always been to focus on the music and grow the music. Okay, that's very, very good. On another note, a last question, then you're free to go. What's your expansion plan? So currently you're in France, but how do you want to expand? So I guess you can say we're very well established in some countries in Europe. The plan right now is to grow the business in the United States. We have some amazing partnerships in Canada as well, I should mention. It's not just the United States. We have some unbelievable connections to the Quebec government, to many top universities in Quebec that specialize in music and visuals. In terms of our commercial strategy, right now we're talking to all kinds of pharmaceutical groups. We're working with hospital groups that have multiple hospitals across the US. We have one pilot hospital that has 18 stations of MusicAir in it, that's providing MusicAir to all kinds of departments. And our objective and our strategy is to keep that tree going. Fantastic. Thank you so much for answering all the questions. Really appreciate it. And I hope, and I'm sure later on at Remo, multiple people will approach you. It's our pleasure. Thank you for the opportunity. Talk to you later. Bye, guys. Thank you. Okay, then last but not least, we have Healint on the line. They are, I would say, by far the most mature already. But I think Alexandre will tell you more about it after the video.
Project number 1 is about data science. It's about analyzing all the data entered by the Migraine Body app users when they track their headache episodes. Our end objective was to gain efficiency on our precision marketing campaigns. Project number 2 with Migraine Body was to develop a program to be inserted into the app. The objective was to support Migraine Body users to better understand the link between headache and their cognitive abilities. So I've been lucky enough to work on a project that really helped me to gain insight on how data science is transforming and will transform further what we do at CHE.
The current project is a pilot, and I really hope that it will lead to a larger collaboration in the future. The main challenge we had to face was the heavy regulation in some countries, which had a very strong impact on some part of the project that we are conducting together. Hello. So my name is Alexandre Rani, and I'm the program director at Healint. The company is actually based in Singapore, but I work from Paris. So for me, the jet lag is not so important. So let me share my screen. So Healint is the company that is behind the famous smartphone app called Migraine Body. With this app, we help people to manage their headache and migraine episodes. So what they do is that they can identify the triggers of their headache and try to avoid them, and also identify the relief methods that works best for them. Today, we have 2.5 million users and more than 50,000 reviews in the different app stores. And every single day, we receive at least one review of happy users from whom we improve the quality of life. That's a very great reward and motivation. We designed the app with only the sufferers in mind. So that's why it's so successful. Our founder and CEO is a migraine sufferer himself and a perfectionist. So he has a special interest in making it work. The Migraine Buddy app is free for anyone to use, but recently we have introduced paid optional programs that users can subscribe to. These programs are educational and cover topics such as nutrition, lifestyle, medical aspects of the condition, etc. They also include tips and tricks and exercises, and people find them very useful. And some of these programs are also free of charge. We have paid and free. Today, 93% of the people using an app to track their headaches and migraine use Migraine Buddy. So we are really the leader of the market. And with all these users and the millions of headaches and migraine episodes recorded, we have a huge amount of data. And the source of this data are first here what patients enter themselves in the app to follow, to track their episodes. Second, the sensors from the smartphone. And finally, we conduct also specific surveys to explore and refine the data. And with all this knowledge, we are able to help companies who want to help patients. So the services we propose to the companies as a B2B service range from marketing to clinical, with first media campaign within the app, market insights, that's what we worked on with Sanofi, digital therapeutics, but also real-world evidence and clinical digital studies that range from patient recruitment only to full management of the study. So that's in this framework that we collaborated with Sanofi, the consumer health department. Sanofi is interested to better understand the patient condition and provide solutions to help them improve, as Celine mentioned in the video. So what we built is a dashboard to explore the data and to do this data science that Celine mentioned. With this dashboard, we have identified a number of insights related to the symptoms experienced by the users, the relief method they use, and also how they are managed their headache. So during these 3 last months of collaboration, we conducted a pilot in 1 country. We identified the needs, implemented the relevant dashboards, and brainstormed also on the insights that are now being translated into actions. Of course, I cannot give you more details here on what we found exactly, but we are all convinced that those insights will be very helpful for Sanofi to provide better services to the patients. Sanofi is also interested to work with us on the aspect that Harsh mentioned in the introduction. It's the beyond the pill topic, because Sanofi is not about selling drugs only, but it's also about understanding how people are going to use the drug and how the patient is going to manage the disease. So the medication from now is just one element of the integrated healthcare solution. So now the next step after the pilot country is to replicate the data analysis on 4 additional countries in order to generate insights specific to these countries. Oops, sorry. So at Healint, we are very satisfied with this win-win collaboration. It has been very enriching. I think that both partners will grow from it. Sanofi could benefit from insights that they didn't have the tools to generate. And Healint learned a lot also with the challenges and questions that were raised that helped us to improve our products and outcome. So the team, the global team, Sanofi plus Healint, was really in an agile mode and very efficient, and we could really do a lot within these 3 months only. I would also like to thank Plug and Play for their support and the initiative, the networking opportunities and training offered. I think it's a great opportunity for Healint to be better known in Europe. And I wish we could all be together in Munich to celebrate with a pint of Polana. Thank you.
We are really wishing that as well. But maybe there's some time in the future to do that. Alexandra, thank you so much for that presentation. We actually already have the first couple of questions coming in. One amongst them is, are you looking to expand your product portfolio in the future beyond migraine?
Yes, we do. We are working now on a new app that is called Clario that has just been released or is going to be released in a few hours. So it's the good day to talk about it. That will be focused about pain in general. So we start with low back pain, and we will focus on new chronic conditions in the future.
Fantastic, that's great news. On another note, how far along the process are you from well, managing your condition? Do you have already the first capabilities to actually predict migraine situations?
So predict migraine, that's something we are able to do. That's not something we really propose. We can predict the end of an episode, but for, let's say, ethical reasons, we don't want to predict the start of an episode, because of course, if you know that you will have a migraine, you will have it. It would be maybe even worse because you expect it.
Okay, fantastic. Then, Alexandra, thank you so much for your time, for your presentation and answering all the questions. We really look forward to have you around for a beer.
Yes.
And also later to network a little bit more. So,
thank you.
So that was the last startup we see today. Thank you very much, all of you, for the interest and for the participation. That's it from my side. Handing over again to Friederike and to very good visions of our part.
Thank you very much, Fabian, and thank you very much, Sanofi and the startups for sharing what you're doing together. I think the comments from the startups show that this collaboration really adds a lot of value for both sides. So we're extremely proud